We got an update today from Maryland Governor Larry Hogan on how close he thinks the state is to reaching its peak of cases. The governor was on Fox News earlier today. He was asked how Maryland is doing in relation to New York and Louisiana, which appear to be peaking now.
We've been really aggressive for the past 35 days, and we're hoping that's going to dampen some of these numbers, but we're definitely at the beginning of the climb as opposed to sort of at the apex where we believe they are, and they're hopefully starting to flatten out. We're hoping our climb isn't as steep, but we're still a couple of weeks away, 10 days, 14 days from reaching the top.
And the other major headline in Maryland today, for the first time since the outbreak began, the state's providing racial and ethnic breakdowns on coronavirus cases. Ike Egiachi's live from Seat Pleasant in Prince George's County here to break it all down for us. Ike?
That's right. On Tuesday, Maryland Governor Larry Hogan ordered the Maryland Department of Health to start releasing racial and ethnic breakdowns for COVID-19. Here's what we found. In Maryland, blacks are testing positive for COVID-19 more than any other race. Over 2,000 black people have tested positive with 55 deaths. The next closest race in Maryland are whites, who make up over 1,500 cases and 39 deaths. The data also says Asians make up 122 cases to 6 deaths. However, there are over 1,300 cases on which racial data just isn't available. Now, it's also important to note, blacks make up almost 30% of Maryland's population, yet account for almost 50% of positive cases in the state. We spoke to Georgetown professor and chair of the Department of Health Systems Administrations, Dr. Christopher King. Take a listen to why he thinks blacks are more prone to the virus.
We know that communities of color are more likely to have hourly wages. They're more likely to have multiple forms of employment at hourly wages. They're more likely to serve on the front line. And so the ability to practice social distancing is a challenge.
It's just killing a lot of us out here, man, and it's just sad, man, I'm saying.
I'm scared because I don't want to lose my life. I got 2 kids out here, so I'm scared. I'm very cautious. I wash my hands every day.
Also in our area, you'll find similar trends. In D.C., blacks make up almost 36% of positive cases, and with 20 deaths, black people make up almost 63% of all deaths in the district. But a large amount, 35% of positive cases, are listed as unknown in terms of their race. However, in Virginia, as of today, whites make up 25% of the positive cases, with black people second at 15%. But a large percentage of cases in Virginia aren't reporting race, 51% to be exact. Now, in Maryland, they're preparing for the inevitable surge that'll happen for the hospital systems here. They said right now that they're preparing to get more hospital beds, especially more ICU beds in the upcoming future. Now, the health experts say the social distancing is working right now. However, for the long term, the community, especially the black community, they'll have to fix those underlying issues such as diabetes, heart disease, what have you, in order to prevent things like this from happening in the future. Back to you in the studio.